Graduated Doctor of Medicine at Far Eastern University, Nicanor Reyes Memorial Foundation. Presently, he is a radiation oncologist, a Rotarian, and the founder of and CEO of CerviQ Med Corporation, the first cervical cancer screening using artificial intelligence technology, a social enterprise and advocacy movement that aims to help eliminate cervical cancer in the Philippines. May I introduce to you Dr. Jesus Randy Boggs Concepcion.
Ay, magandang hapon, no? Ay, magandang umaga pala, I'm sorry. Anyway, I just would like to let you know, no, number one, na alam niyo naman, no, pag sinabi niyong cancer, ano bang what comes to mind? Diba, normally what comes to mind is end, diba? Mamatay na and everything, no? But do you agree na there is one cancer, one type of cancer na pwede nating i-eliminate? I'm not saying prevent. I'm saying eliminate. Okay. Shown on to you on the slide is the cancers po sa mga kababaihan. Although hindi ko naman inaalis yung mga lalaki dito, but later on, please try to listen kasi isa kayo sa mga solusyon, no? Bakit nagkaganon sila, no? Ako din is guilty. One is it's breast cancer. Ang problem with breast cancer, we cannot entirely eliminate it because it's namamana. Diba? When you pass it on to your children, wala ka lang magagawa eh, diba? You cannot desist an order, diba? You cannot go to our mayor and say, no, I don't want that kind of pamana, no, sa nanay ko, no? So you cannot do that. Cervical cancer is different. You can prevent it mula sa children ninyo, mula sa inyo. Next slide. So cervical cancer is the second most common in women, no? It is said about 4,088 are namamatay po taon-taon. Roughly, sinong magaling sa math dito? Meron bang mathematician dito? Paki-divide nga ho, divided by 365 and 1/4 days. Okay, 11 po. Roughly around 11 to 12 po ang namamatay kada araw, no? Wala po yan sa dyaryo, wala yan sa tiktik, sa remate, you know, wala sa radyo, no? But they are dying, no? Next slide, no? Sabi nila, kung ikaw daw ay merong magkakaroon ka ng cervical cancer, no? 1 in every 2. So, ibig sabihin, kalahati. 50% of people who are diagnosed to have cervical cancer will die in the next 5 years, whether you like it or not, especially here in the Philippines. Next slide. Pero, talaga ba talaga na can you really prevent it? Well, we'll see. Who said that you can prevent it? Next slide. Watch this video coming from the World Health Organization.
In May 2018, we issued a call to action to eliminate cervical cancer. No woman should suffer from a deadly disease as both.
Obesity is especially acute in vulnerable communities and in developing countries where the burden is greatest. At the direction of WHO's member states, we mobilized with countries, partners, experts and advocates to develop a global strategy for elimination, which was adopted by the 73rd World Health Assembly.
To set countries on the path towards elimination by the year 2030, we must aim to achieve the 90-70-90 targets.
90% of girls to be fully vaccinated with the HPV vaccine by age 15.
70% of women to be screened at least.
No? So ano yung guidelines how you can eliminate cervical cancer? So number one, sabi ng World Health Organization, 90% daw po ng mga anak natin age 9 to 14 years old should get an HPV vaccination. No? Of course, we cannot promote that sa buong bansa because not all of us can have the money to get for vaccinations. Those who have the capability to get the vaccines, we will help you get it through MSD, the Merck Sharp and Dohme. Next slide. That's 90. 70. 70% daw ng mga kababaihan. Hindi na ako magtatanong dito, hindi na ako magpapa-raise ng hand, no? Kung sino ang nagpapa-screening sa inyo, nagpapa-pap smear and everything, no? Pero isipin, i-internalize na lang natin. 70% daw po ng kababaihan should undergo cervical cancer screening. Taon-taon or every 2 years or every 3 years. And then 90% nung mga nakita nilang merong problema doon sa cervical cancer, no, doon sa ini-screen, dapat daw magamot, no? Pero kung ganun, kung pwede naman palang i-prevent yung cervical cancer, bakit 11 ang namamatay araw-araw sa Pilipinas? Next slide. So why are there so many women dying of cervical cancer? There is one report. Isang report lang po coming from the World Health Organization. Pag nakita ninyo, masasabi nyo, ay, kaya pala. And this is the report. Next slide. 1% lang po ng total population ng kababaihan ang nagpapa-screening taon-taon. That's age 30 to 50 years of age. Bakit? Hindi alam, kulang sa awareness. And this is what we're trying to do today, no? We're trying to let you know bakit and what is cervical cancer. So what is cervical cancer? Okay, start tayo. Sige, next slide. Okay, just a reminder, no? So ito yung guidelines ng WHO 1970-90. Next slide. So ano po ba ang cervical cancer? So ang cervix po, no? Kasi nag-ikot kami diyan sa Manila, no? Tinatanong namin ano po ang breast. Madaling isipin, ang breast is, breast. But when you ask a person, what is cervical cancer? Sabi nila, yun ang nakikita kong sagot. Ang cervical cancer ay part po ng bahay bata, matres. Next slide. Ito pala. Ito, okay. So it's part of the bahay bata, no? Ito po yung pinakailalim na portion, no? So this is the bahay bata. Ito po yung pinakalalim na portion, no? So kung mamaya, ang ginagawa namin, para din malaman ninyo, magpapasok kami ng speculum, no? Depende yan doon sa experience ninyo, no? Kung kayo ay, again, we're not trying to be, bastos, but again, kung kayo ba ay 5 na ang anak, or, isa pa lang, of course, kung kayo ba ay CS or vaginal delivery, of course, we tend to understand yon, no? Is there pain? Yes, there is pain. Di kita lolokohin. Pero, ang sinasabi ko lang, it's tolerable, no? It's not something na Anyway, pagka yung matapang muna yung mauna, kasi baka mamaya yung takot, baka mamaya biglang magsisigaw dito, wala nang sumunod, mamakaisa lang kami today, no? But then again, I'm just trying to make So, yung mga Gabriela silang muna po dyan, no? Yun ho munang inaalaw ho muna namin mamaya, ha? Okay, so, ito po yung cervix, no? Next slide. Now, ano ho ba ang dahilan? Yan, maganda na to. Kasi yung mga lalaki kailangan kong tingnan dito. Ano ho ba ang dahilan ng cervical cancer? Next slide. HPV. Yan. Ano po ba ang HPV? Ito ba katulad ng HIV? Ang HIV po, tingnan niyo po ako. Ako meron. Hair is vanishing. Kaso nauntog yata ako. Baka namumula na yata yung dito ko. Nauntog ako sa taas kanina Anyway, so HPV is a virus, no? It's 99% the cause of cervical cancer. Okay, so tama bang sabihin na kung HPV virus ito at kung hindi mo makuha ito, hindi ka magkaka-cervical cancer, tama ba? So that's one way how to prevent it. Next slide. Of course, you can get it through others, no? If you're nung nagbubuntis ka, binigyan ka ng doktor mo ng diethylstilbestrol. But we don't do that anymore. We don't give that anymore. Matagal na naming hininto yung pagbibigay ng DES, no? Next slide. Of course, OCP, no? Yung mga nag-oral contraceptive pills dyan, syempre, medyo may maliit na risk. Maliit lang po, 0.00 something, no? So you don't even have to worry. Mas matakot ka kay HPV. Okay, next slide. Of course, there are other risks. Smoking. Pag naninigarilyo kayo, lalo na yung kababaihan, no? Pag meron kayong HPV, si HPV mahal na mahal kayo, hindi na ilalabas ng system niyan. Di ba? Kasi ang HPV, normally lumalabas yan sa system mo. Hindi naman, lahat tayo, actually, I'll go straightly to the point. Lahat tayo magkaka-HPV in some years of our lives. Ang problem is, sa mga iba, na ilalabas natin yan. Sa mga naninigarilyo babae, medyo hindi siya makalabas, no? So that's one of the... Kaya, if we can stop smoking, thank you. Next slide. Of course, sexual history, no? Gaano ka unang nagka-sex? That's very, very important. Itatanong yon privately, no? 11, 12, it's okay. 21, it's okay. 42, it's okay. Don't worry about it. At least alam namin when will you are expecting to have yung cervical cancer. Kasi may relasyon yon, okay? Hindi siya yung ganun-ganun lamang. There's a reason why we're asking, kailan kayo unang nakipagtalik? And walang masama doon, ha? Lahat naman tayo. Yes, na-divergenized daw, sabi ni Miss Jo. Tama yon, oo. Maging tapat lang tayo para ma-calculate namin kung yung nakikita ko personally at yung resulta na makikita namin at yung resultang ipapakita ko sa inyo. There is a correlation, more or less, parang ganun, ha? Of course, kung gaano karaming sexual partners meron kayo, maging tapat lang kayo. Okay? Hindi kami nandirito. Okay? Hindi kami nandirito sa Manila City Hall para manghusga ng tao. Okay? We are here to really help. Kasi mamaya makikita nyo bakit. Weakened immune system. Ito, ang ibig lang sabihin nito, yung mga taong may AIDS, no? Yung may AIDS na, no? Sila ang very, 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 very prone to have cervical cancer. Nakikita namin yan, no? Of course, chlamydia infection. Chlamydia is a sexually transmitted infection. And young age at full first term. Anyway, hindi masyadong very, very, very minimal. Next slide. Okay. So, ito yung sinasabi ko. If we can prevent HPV, then we can prevent the elimination of cervical cancer. It's simple as that. Next slide. So, what is now HPV? Yan, no? Namumula pa ba yung ulo ko? Masakit eh. Gumagano'n-ganon eh. Hindi kasi nagmamadali ako kasi I was trying to get my phone, no? And then, all of a sudden, boom! Aray ko. Anyway, what is HPV? HPV is a virus. Okay. Ang HPV ay in human papilloma virus. Pag tinagalog mo yon, pag sinabi mong papilloma, what comes to mind? Kulugo. Ay, may kulugo ako dito. Ibig sabihin magkaka-cervical cancer ako. Hindi. Relax lang kayo. Relax. Chill. Okay, next slide. Next slide. So, HPV is a group of 150 types. Iba-ibang klase yan. Magkakamag-anak. 150 types. No? Na kung saan, karamihan daw ay harmless. Ibig sabihin, yung mga nakikita nyo sa skin, no? Dito sa muka, sa ulo, na namumula, no? Sa katawan, sa likod, sa paa, no? These are harmless types. Okay lang yun. Pero, merong HPV doon sa ari. Mapalalaki, mapababae, no? Yung mga kulugo doon, nakakatakot yun, no? Yun ang mga nakakapagbunga ng cervical cancer. Mamaya, ayan, makikita nyo. No, kung ang iniisip ninyo at kung ang dinidiscuss ko ngayon is only cervical cancer, mga lalaki, you can also have cancer because of HPV. Okay? Mamaya, alamin natin. Next slide. So, ito yung itsura, no? Gusto ko lang makita ninyo, no? Yung itsura, ang pangalan ko po sa Facebook, Box Rivera, no? Pwede kong isend sa inyo yung picture. Paki-check na lang, no? Meron din po kaming salamin, ha? Binibentang salamin, no? Para yung kusang, hindi, joke lang yun. Pinapatawa ko lang kayo, okay? Pinapatawa ko lang kayo. Okay. So, para siyang kulugo, no? But it's on the area ng puwet, that's part. Ngala-ngala, that's part. are, genitalia area, no? Those are suspicious of cervical of cancer, no? Next slide. Ito po ang listahan ng mga cancer na po pwede nyong makuha sa HPV, no? Sa babae, puerta, vagina. Vulva, yung panlabas ng vagina. Cervical, yung pangloob ng bahay bata, no? Yung cervical, no? Sa lalaki, puwet, at saka sa babae, puwet, no? Sa bibig, oral, oropharyngeal cancer, no? Mamaya, bigyan ko yung example. Ano pa ba? What did I miss? Penile cancer, no? So, meron ding penile cancer. Yun nga lang, hindi ganun kataas. Ibig sabihin, kung sa cervical cancer, saan na ba yun? Ayun, kung sa cervical cancer, almost all, no? Cancer cases are caused by HPV. Sa throat and mouth, it's only 20 to 35%. Sa penile, 40 to 50%. Puwet, 80 to 90%. Warts ito, no? Kuluguyan sa are, no? And then vaginal cancer 40 to 50. Sinong may kakilala kay Michael Douglas? Yun. Michael Douglas, no? Ayun, yung kapitbahay mo. Diba? Si kumparing Mike. Oh, nagpunta sa akin yan. Meron siyang oropharyngeal cancer. Yes. But he survived kasi early, no? He had an HPV type. Non-official, not official, Val Kilmer has a cancer ngayon, but they don't want to say if it's, siyempre nakakahiya kasi, no? Kung meron kang paano napunta, teka nga muna pala, paano napunta yung HPV dito? Mag-isip ka na lang. Sige, mamaya malalaman mo bakit. Anyway, sige, next slide. Di ba? Transmission, yan. Paano daw napunta ang HPV sa throat? Nako, imagine rotary. O yan, sige, next slide. Okay, ang transmission po ng HPV na is skin to skin contact. Okay? It can be oral sex, it can be anal sex, and it can be the usual sex, no? Yung usual na ginagawa natin, no? Male to female. So, of course, next slide. Oh, yun. What is digital sex? Digital is digital. So, ibig sabihin ba, pag nanood ka ng porn, magkaka-HPV ka na? Hindi. Digital is kamay. For example, I have HPV in my are. Okay? I hold it. I put it inside a girl's vagina. HPV can be transferred. So, ang point dito is, hindi na, single ako eh. Walang nakipag-sex sa akin. Ang partner ko, babae. Uy, pwede. Kasi si babae, sorry again, I'm not trying to be, dito. Si babae, kung meron siya, and si babae na yon, nakapartner mo, merong lalaki na nakipag-sex, and then si babae get it, and then you do rubbing one another, again, I don't want to specify, no? Because it's in the morning, perhaps siguro mamayang 9:30 I can be, wala na yung MTRCB, no? Baka mamaya pwede na ako. And besides, I think we're live, no? Imagine na lang, you can have, So alam ko, in your back of your mind, marami kayong tanong eh. Pero you can ask me, pagpunta kayo doon, no? Anyway, go ahead, next slide. So, ang transmission today is no longer, dahil sa'yo ko nakuha, ikaw lalaki. Di ba? Naka-video eh. Tinuro ko siya. Okay. So, hindi na ngayon yon, hindi na uso ngayon yon. Si lalaki can get it from another guy. Okay? That's anal sex or something. Perhaps nag-ispadahan sila, I don't know, Anyway, again, I'm not trying. Sorry. It can be girl sa girl. Of course, I'm not a girl, so I don't know how it works, no? So, and then the usual route, which is a male and a female, no? So, yan. Next slide. Okay, so you can also get it from an infected birth canal. Kung kayo ay buntis, nanganak kayo vaginally, pwede, no? Pwede nyo ma-transfer yung HPV sa anak ninyo. In fact, there was one documentation, no, sa Japan. Next slide. Okay, anyway, wala na yun. Oh. And fomites, what is, balik ka. Fomites, very rare. Fomites are, a good example are sex toys. You know, I mean, nowadays, alam mo naman, you know, people are very imaginative, you know. May pointed, may blunt, may round, may whatever, may long, may short. You know, parang bond paper lang din. So next slide. So symptoms. Yan, wag ko muna. Ano sa tingin nyo ang symptoms ng HPV pag meron ka? HPV, ano ang symptoms ninyo? Ang tulo sa lalaki, which is an STD, which is also a sexually transmitted infection, nahirapan kaming umihi. Naglalaway daw. Oo, yun. Okay. Pero, pwede, di ba? Oo. Ito. Wala pong simptomas. Ang HPV, wala. And that's the reason why sinabi ko kanina, you can get it. Because hindi ko masasabi, uy, sino bang may HPV dito? Wala eh. Everybody will have HPV. No? I'll tell you again why mamaya. Next slide. Hindi ko alam kung ano yung next slide ko eh. Ayan, okay. Bakit lahat tayo magkaka-HPV? Look at the slide, no? Look at HPV infection. Ito, tuturo ko Yan. Saan na? Saan yung kamay ko? Yan. Okay. It starts from 15. Kasi, lalaki, babae, yung curiosity natin starts at the age of 14, 15, looking at other people, no? So, it's the time na curious ka sa katawan mo, curious ka rin sa katawan ng ibang tao, no? And then you do whatever you want to do, no? And that's the start. That's the start of whether yung rise of HPV infection. Normally naman, aminin natin, nung 18 tayo, meron na tayong karanasan. Most of us, maybe, yung iba, baka hindi naman, no? Pero sinasabi ko generally, buong Pilipinas, 17, 18, 19, normally meron na tayong karanasan, di ba? And then, it wanes down. Ngayon, yung cervical pre-cancer. Pag sinabing pre-cancer, ito yung period na hindi pa siya cancer, no? Papunta pa lang, no? Makikita mo, it's about nasa mga, roughly I would say mga 20-25 years. Normally, from the time na magkaroon ka ng HPV infection, mga 5 to 20 years bago mag-develop yung pre-cancer. No. 5 to 10 years bago mag-develop yung pre-cancer. 5 to 10 years na naman bago ito mag-develop into full-blown cancer. And that is the reason why we are asking women who are 30 years of age. Kung ako, nakipagtalik ako ng 14, so I may be able to have pre-cancer at the age of 24. No? So kung ganun kayo, magpunta na kayo. Kaso nga, no? Si secret na lang, doon na lang kayo sa clinic para walang nakakaalam. Pero ganun yun, no? Yun yung reason, no? Yun yung sinasabi ko, kinikwenta namin or whatsoever, no? Ngayon, kung wala pa kayo talagang naging partner sa buong talambuhay nyo, pwede naman kayong magpa-screen. Oo, doon sa vision, wag na sa akin, ha? Oo. May vision din, ha? Oo. Baka mamaya, dalaga po ako, madre po ako, papascreen po ako. Ay, ma'am, doon po kayo sa vision, wag po sa akin. Oo. Anyway, joke lang yon para lang magising tayo, no? So, another 5 to 10 years bago magkaroon ng cancer. So, nakikita namin ngayon na mga pasyenteng may cancer are about age of 30 to 50. Yun ang high risk, no? Now, kami, wanting you to know, ang nakikita namin ay pre-cancer. So, papunta pa lang. It's very important sana, kung ako mga susunod, na for you to get your screening today, no? Kasi, ang nakukuha namin is yung pre-cancer. Kung meron kayong mga kapitbahay dyan, tawag-tawagin nyo na, no? Sa cellphone, mali mo, baka pwede pa naming ma-entertain. No? Anyway, next slide. So, don't wait for the symptoms to appear. Kasi, ang symptoms ng cervical cancer, one of the frequent symptoms is vaginal bleeding. Kapag dinudugo na kayo, nag-vaginal bleeding na kayo ng dire-diretso, or at least, you are already on the stage 2, stage 3. So, wag niyo nang antayin duguin. Kasi kung hindi, delicate na kayo. Delikado na kayo, no? Yung chances niyo of survival is low. And yung babayaran nyo sa amin, katulad ko na ako ay isang radiation oncologist, is high. Kung kayo ay ma-detect ng pre-cancer, ang babayaran mo kahit na dun sa pinakamahal na ospital would be something like less than 20,000, no? Cheaper than pag may cervical cancer ka na, which you will pay around 200 to 300. I've seen patients paying up to 1 million pesos, no? Just to cover everything. Depende yan sa sa hospital. Kasi ako publiko lang naman kasi ako eh. Hindi ako private na hospital, no? Next slide. Okay, so these are the symptoms, no? Unusual vaginal bleeding, abnormal vaginal bleeding, no? Heavier and longer menstrual cycle. So mas mahaba yung mens mo kaysa dati, no? Sometimes, discomfort in urinating. Pero wag yun ang antayin yan kasi pag mayroon ng discomfort in urinating, ibig sabihin, apektado na ang pantog. Nako, nasa stage 3B na kayo to 4. Next slide. Loss of bladder, pain during intercourse. Normally, yung mga pasyente naming nakadiagnose, pag sila daw ni Mister, dinudugo. No, yun daw yung isang mga initial na symptoms na nakikita nila, no? Constant fatigue, of course, pelvic pain, unexplained weight loss at saka leg pain. Wag yun ang antayin maging ganyan kasi kung yun ang batayan ninyo, sigurado nasa finals na kayo. Pang championship na kayo. Oo, hindi pa ho nagsisimula yung basketball kayo, pang championship na. Next slide. So I just would like to point out, no, yung chances niyo of I know this is yung stage of distribution ng cervical cancer sa Philippine General Hospital, no. So makikita ninyo, no, karamihan are in the stage 3 na, no. 52% of patients going to PGH are in the 52%. Next. So how do you prevent? Huwag kang makipag-sex. Ay, napaka-sad naman yata. No, oo. Napaka-sad naman. Huwag naman ganun. Okay, so prevention, next slide. One is vaccination. I am encouraging you, like I said, no, yung mga anak ninyo, no, can get the vaccination, no. Kung, of course, it's 9 to 14 years of age, no. Bakit 9 to 14? Ang reason is because at the age of 9 to 14, kadalasan, hindi ko sinasabing lahat, kadalasan wala pa silang pakikipagtalik, no. And secondly, because pag binigyan ka ng injection at 9 to 14 years of age, no, mataas yung immune response mo, no? Mabisa, mas mabisa yung gamot in preventing HPV, no? So, two factors. Now, Doc, ako ay 26 years old, pwede pa ba ako? Pwede pa. Pero ikaw, ang bibigay ko sa iyo yung medyo higher na, yung HPV-9. Pag HPV-9 ang bibigay ko sa iyo, syempre, medyo 9 na rin yung, medyo mataas na rin yung presyo. It's not me, no, but it's more of the gamot itself, no. Next slide. So we have 3 types of vaccination, no, yung HPV-2, HPV-4, and HPV-9, no. HPV-4, yan, sinabi ko lang sa inyo, no. Habang tumataas yung number, mas maraming strain ang napiprevent yung anak ninyo na magkaroon ng cervical cancer. There are 14, okay, 14 types of HPV subtype na nakakapag-develop ng cervical cancer. Walang bakuna ang makakapag-prevent entirely, no? Ang pinakamalakas is HPV-9, which covers about 90%. HPV-4 covers about 70%, men and women. HPV-2, 70%, pero women lamang. Next slide. So, hindi masyadong okay. So, ito yung dosing, no? Pagka ikaw ay 9 to 14, no? Ano to ha? Yung edad ito ha? Base ito sa birth certificate ha? Kasi baka lumapit sa akin, Doc, 14 years old pa lang po yung utak ko. Pero ako po, 62 na. 3 doses ka pa rin, ha? Pero pag ikaw ay 9 to 14, physically ha, ba ayon dun sa Manila registry, no? 2 doses. Pero pagtaas, 3 doses. Okay, yan. Okay, so next, ang pagbibigay kadalasan is 0, pag tatlo, 0, 2, at saka 5. Ngayon, after 2 months, then after 6 months. Pagka dalawang dose, ngayon, at saka after 5 months. Yan. Next slide. Okay na yan. Next slide. Sige, next slide lang. Okay. Ay, sige. I'd like you to watch this kasi this is medyo dramatic ng konti. Sige. Let's